Coverage of the 26th annual meeting of the ASMBS is sponsored by Allergan, makers of the lap band AP system.
Hi, this is Leslie Thompson for the Weight Loss Surgery Channel, reporting from the 2009 annual meeting of the American Society for Metabolic and Bariatric Surgery. And I'm here with Dr. Sunil Boyarul, a bariatric surgeon from La Jolla, California. Has been in practice 9 years. And Dr. Boyarul, first of all, thank you very much for joining us today.
Thank you.
Now, you and I were talking a little bit earlier about the importance of post-operative follow-up and compliance on the patient's part when it comes to their long-term success with weight loss, regardless of what kind of procedure they have, whether they have a bypass or a band or a sleeve. However, you made an interesting point about that the lap band can really leverage that post-operative compliance. Can you speak to that a little bit?
Yeah, let's talk about leverage. Leverage happens in the context of the doctor-patient relationship. So every patient who comes into bariatric surgery is, by definition, self-driven. They come in and they want to have surgery, and they're willing and committed to making changes, behavior and lifestyle changes to make the surgery successful. So that's a great thing. And before the surgery, we have a lot of leverage in our patients. We say, look, if you're willing to do this, then I'm willing to operate on you. And there's that leverage that you have before the operations, and patients do very well with that. They'll lose weight, they'll get on the liver shrinking diet, they'll start exercising, and everything will go well. And then after surgery, many patients will continue doing very well. And they're self-motivated and self-driven, and they have great environmental support at home and at work and so on and so forth, and they're fine. Many patients need more support. Many patients need just a little bit of extra help, and we need to be able to leverage our relationship with the patients to provide that help. So there comes a point after, say, a gastric bypass where you can talk to a patient as much as you can and want to and like to, and the information is absorbed only in as much as the patient chooses to absorb that information, which is based on so many different things that are going on usually at home. With the band, we have a unique perspective because it's more than a conversation. We have additional leverage at these post-operative visits. Patients come to see us after a band, and we say, look, you know, you're doing really well, and let's focus on the positives, but in order for you to do better, there are two things that we need to do. You need to make these changes, and I need to make the adjustment. And so I will make the adjustments in contract with you making these changes. And so suddenly it becomes a more active relationship on the doctor-patient part, and less of a passive relationship. And the patient really, you know, is more incentivized, shall we say, to work with you and to be part of that doctor-patient partnership. So it's a very, very powerful tool. We also find that the more often that you follow up with your patients, the better the result's going to be. But it's not just because you're seeing them more often, it's because the patient comes in and they're asking for an adjustment. They're asking to be inflated or deflated, and you're saying, look, okay, I'm willing to do this, but here's what I'm asking of you. And so it's a wonderful relationship. It's changed the dynamics of the doctor-patient interaction completely.
That's very interesting. So it really adds just that extra level of accountability where right. If people have challenges with that personal accountability and sticking to their program, right. Just that having that communication with their doctor
absolutely,
can facilitate.
Absolutely. And the key is to be preemptive about it as a doctor. Don't say, come in and see me when you need an adjustment. Say, I want to see you once a month, every month. Here's our next scheduled visit. So when the patient knows that they're coming in to see you, and they know that you're really only going to adjust them if they've done their part of the deal, then that's a very powerful tool. But if you say to a patient, come and see me if you need an adjustment, some patients will even deliberately not come and see you because they don't feel good about themselves. They feel that they've done badly, and they don't want to disappoint you. But if they know that they have to see you in a month, they will. And so it's just a very powerful part of our relationship with our patients.
Now, how does that work long term when a patient has reached their goal weight, they're a healthy weight they're maintaining, they may be 3 or 4 years out from lap band surgery, they don't need to go in for a fill every month or even, you know, a couple times a year?
That's a very good point. Well, the psychologists talk about conditioning, that in order to enforce a long-term behavioral change, you need to psychologically condition that behavioral change. And it turns out that the vast majority of conditioning can actually happen in the first year. So the first year is the honeymoon year, if you like. And with band patients particularly, that's the most important time to condition our patients and to make sure that they're making the right behavior and food choices. And if they can and they get it, they're sailing. And then the visits after that, 6 monthly or annual visits after that are almost like, old family reunions. They come in and they're conditioned and they're ready to go and everything's good. So that's one group of patients who'll do very well if they've followed up with you the first year. There's another group of patients that are struggling. But I prefer those patients as rescue patients. They'll come in 3 years after having had a band. They did very well for a while, and they lost their job, they went through a divorce, something happened in the environment, and it's been hard to keep up with those behavioral changes, and they didn't see you, and they've gained 50 pounds, and they come and see you now. The nice thing is, you've got more leverage. I can rescue that patient. I can say, look, you know what we're going to do? We're going to tighten you up for a couple of weeks, where it's going to be a little bit uncomfortable for you to eat, but you're going to get that positive feedback of losing weight again. You're going to feel how good it is and how wonderful it is to lose that weight. And you rekindle that relationship based again on leverage, because you have something you can do, as opposed to sympathizing with them when they've had a malabsorptive procedure and you can provide advice but no rescue. But the ability to rescue your patients long term is really very cool about the adjustable procedures.
Yes, well, that is a very interesting benefit to the lap band that I had never heard about and hadn't considered. So Dr. Boyrell, thank you very much for sharing your insights. We really appreciate it.
It's my pleasure.
And thank you for joining us today. I'm Leslie Thompson for the Weight Loss Surgery Channel.